In this video we discuss osteochondral fractures. The term osteochondral fracture is used when there is a fracture of part of a joint surface. Osteochondral fractures appear as a combination of fracture line extending to the joint surface, depression of the subchondral bone plate, and articular surface disruption or fragmentation. Cartilage is not visible on X-rays, but the attached piece of bone from the articular cortex can be seen, often visible as a thin flake. It may be undisplaced or lie away from the donor site elsewhere in the joint. The bony component of the osteochondral fragment has a smooth, rounded articular surface on one side and an irregular uncorticated appearance on the surface, which has fractured. As damage to a joint surface has long-lasting sequelae in terms of pain and stiffness, an apparently small fragment may have considerable significance.
If you like the video, you can like it, comment it, and share it with your friends. If you are not subscribed yet, please subscribe and click the bell button.